And let's take a deeper look at the COVID situation around the country. We're joined by Dr. Norman Swan, presenter of the RN's Health Report and the ABC's coronacast. Good morning to you, Norman.
Hi, Lisa.
Hey, tell us what's going on in the UK. You're looking at some new vaccine effectiveness data.
Yeah, they've done a really good study. People want to know just how good the vaccines are. So this is a study of whether or not the vaccines prevent infection. So we know they're very good at hospitalisation and severe disease, but do they prevent, to what extent do they prevent actually getting infected with the virus, whether you're symptomatic or asymptomatic? 380,000 people, 221,000 households. And this wasn't leaving anything to chance. They were actually doing regular PCR tests on people, regardless of whether or not they were symptomatic, and measuring it against their vaccination status. So the bottom line here was good news. AstraZeneca, 67% on average effective against reducing infection, which is more than certainly we've been quoting on coronacast. And Pfizer, 80% effective at preventing infection. The younger you were, the higher the degree of protection. So it goes up to 70-odd% with shows you the young immune system is really good for you. 70% with Astra, but 90% with Pfizer. If you'd had a prior infection and a vaccine on top, you got even better immunity. And just having had the infection gives you about the same protection as an Astra vaccine. So all that was really good news, and it didn't really seem to matter whether the dosage interval mattered, although that's pretty precarious in Britain. I wouldn't take too much from that. But here's the issue. Pfizer, the effectiveness declined by 20%. That's not an absolute 20%. That's, if it was 90%, it went down by a fifth and then a fifth again. But each month it went down by 20%, 22%, whereas Astra didn't. And Astra stayed roughly the same. And about 4 months they crossed over. So Pfizer dipped down below Astra, and Astra kept on going, which is great reassurance for people who've had AstraZeneca. So all in all, this shows that these vaccines have the power, as you're seeing in New South Wales, to really bend that curve.
Feeling even better about my AZ shot this morning, I'm sure, as you are, Norman.
Absolutely.
Now, next hour, we're joined by both Gladys Berejiklian, the New South Wales Premier, and her Victorian counterpart, Danielle Andrews, to talk about both states gradually opening up. Gladys Berejiklian has said, in her words, cases will go through the roof once the opening up happens. So the obvious question is, should we be concerned, Norman, about the intensive care capacity in our hospitals?
Yes, we should. We might be okay. The hospitalisations seem to be dropping in Britain. We've yet to see what happens in Denmark and Norway as they've opened up, but we really do need to be very careful about that. They could get overwhelmed. Particularly, we've got a lot of tired clinicians in both Victoria and New South Wales, and the capacity. And if you get an outbreak in a hospital, then you could have staff on furlough. So it's a really serious issue. And last night on the Health Report, I actually covered an issue that's not been dealt with as far as we can see around the country, and maybe something to ask the premiers, is that the ICU staff and ED staff are going to have to make some difficult decisions if they're overwhelmed about who gets treated and who doesn't. And the states have been running for cover on this and not really showing whether or not they've got a process in place that is fair and transparent and understandable for people about who gets treated and who doesn't, because it may come to that. For example, there's an issue about something called the clinical frailty score, which is assessing the frailty of people coming in. Well, if you're a frail elderly person and somebody says, well, you're not going to get treated because you're a bit frail, you might get understandably a bit upset. But some difficult decisions may have to be made, and we need a public discussion about that. And now, because we've only got a month or 6 weeks to go before trouble could hit.
Good news, I guess, though, some of the reporting this morning, and you just touched on it, about the ICUs, actually, the hospitalisation rates and the ICU rates are lower than what the Burnett Institute modelling was predicting. So hopefully that is an indicator of where we're heading.
That's right. And that's right, and it will move down into younger groups who are less likely to go into ICU, although they will. But if the numbers do get high enough, you will get particularly younger kids ending up sick, but not as frequently as older people. So we've just got to be really careful that we keep some controls in place, and we do it in a staged way, which is what Denmark, what Norway's doing, and not just as Victoria can watch New South Wales can watch Denmark and Norway to see what's happening there. So we're probably less reliant on modelling now as to what happens in the real world.
Norman Swan, thank you so much.
You're welcome.